Hi, Dr. Sasse here from the Continence Center. Just wanted to say a little bit more about a holistic response to and a kind of integrated response to pelvic floor problems, and particularly bowel and bladder incontinence. We're mostly known as a center that does sacral neuromodulation, and of course we think, and the data shows, that that's the most effective therapy, and it's a very non-invasive therapy. But it's also true that we think a holistic approach where we work at this problem from all angles is critically important. So for example, we do think that exercises and pelvic floor therapy can play a very important role in both rehabilitating the pelvic floor but also maintaining the success of it over time. And so for that reason, each and every person is expected to enroll in a pelvic floor therapy program that is specially designed to help recruit the pelvic floor motor responses and improve the sphincter control, as well as the overall pelvic floor support for both bowel and bladder problems. We'd like for that to be done early and also on a continuing basis over the long haul. There's some other things that can also help a great deal, so it's not just all relying on the sacral neuromodulation. And although it does a great job at switching back on your own pelvic floor muscles and getting your nerves and muscles to talk to one another again, it is also helpful to give your body every fighting chance and every advantage. So that sometimes means don't overwhelm your system with a lot of excess fluid intake and caffeine and alcohol intake late at night before you go to bed, or that bladder is going to be overactive and it's going to be leading you to have nighttime possible incontinence or nighttime voiding that's could be avoided. And likewise on the bowel side, if the bowel consistency tends to be fairly loose or sometimes diarrhea, then hardening those stools with some Imodium and fiber and finding some dietary adjustments can make a very big difference to make it easier for the body to maintain proper control just by improving the bowel consistency toward a harder bowel movement. And so these are examples of ways in which, with diet and fluid adjustment, exercises and pelvic floor therapy, we can really optimize the results and make it so that your life is better and you're not worrying about accidents during your day, and limiting your social life, and your quality of life is not being diminished by bowel and bladder leakage accidents. So while the cornerstone of therapy, in our view, resides with sacral neuromodulation, the most effective therapy that's ever come along for this, we think that it pays great dividends to look at this holistically and do everything that you can to kind of optimize the great function of those complex nerves and muscles that compose the pelvic floor and that lead us to have proper bowel and bladder emptying and bowel and bladder control. Okay, I hope that gives a little overview of how we approach this philosophically and how you can have the best results. I wish you the best of success.